Good evening. It's a pleasure to be here with you tonight. Thank you to Dr. Rios and Dr. Loveras and the entire NHMA steering committee for allowing me to be here as a mom on behalf of Moms Clean Air Force. Here to discuss the health impacts associated with climate change and how we can work together to improve the health of Latinos and Hispanics. First, let me begin by telling you a bit about who we are at Moms Clean Air Force. We are a community of moms and dads united against air pollution to protect our children's health. We are nationwide in 23 states with 900,000 members and growing. We advocate for cleaner air in order to protect the health and future of our children. And our focus is mainly on education and advocacy. We work together to educate parents, create and foster dialogue. Why do we care at Moms Clean Air Force? We care because our children are most vulnerable to our health and the impacts of climate change. And because lessening air pollution is an essential step in limiting short and long-term health impacts of climate change. What do we want? We want Congress to take action on climate change. We want action on climate change to protect the most vulnerable, our children, nuestros hijos. We want renewable energy and energy efficiency in our homes and communities. We have the solutions, now we just need to use them. We support federal actions that limit the pollution causing climate change. Here are a few things that we're working on. We are connecting the dots between climate change and children's health, building support for standards that limit climate pollution from carbon, methane, and smog, bringing the voices of parents to decision makers at the local, regional, and national levels, encouraging a national conversation about climate change that moves beyond partisanship to focus on families and communities, nuestras comunidades. Who am I? I am a former Porter Ranch resident, a Central American born in Guatemala. I'm a mother of 3 children to Mason, 5, Madison, 2, and Miles, 11 months. We were all directly impacted by the October 23rd Aliso Canyon blowout just 2 weeks after giving birth to my youngest son, Miles. I'm sure you've heard of this unfortunate and preventable catastrophe, but let me give you a little background on it. The Aliso Canyon storage facility spewed over 97,000 metric tons of methane from October through February, which is equivalent to over 8 million metric tons of carbon dioxide being released. 15,000 people were impacted by this preventable disaster, and it cost more than $700 million in cleanup costs. I chose to relocate my family far away from the toxic pollutants in the air because when methane is combined with volatile organic compounds such as benzene and toluene, it makes for a dangerous cocktail of air pollution. I was not going to risk my children's health. No, not this mama bear. This is what drew me into Moms Clean Air Force. I knew right away that this group of moms got me. What is methane and methane pollution? Methane is a powerful greenhouse gas, many times more potent than carbon dioxide. Greenhouse gases in our atmosphere trap the sun's heat on our planet. Releasing methane into the atmosphere is bad for our climate because in the short term, methane is 84 times more potent than carbon dioxide as a greenhouse gas pollutant. It doesn't last as long in the atmosphere as carbon dioxide, but it is much more powerful while it's up there. So it's helping to drive dangerous climate change right now. Methane, the primary component of natural gas, comes from many sources such as agriculture and landfills. But the natural gas operations are a major source of methane pollution, accounting for close to 1/3 of all U.S. emissions according to the EPA. Methane is not the only pollutant from the oil and gas industry. Where there is methane leaking, so are other air pollutants alongside it, known as volatile organic compounds. So let's talk a little bit about 2 volatile organic compounds. The first one is benzene. Exposure to benzene can cause skin and respiratory irritation, and long-term exposure can lead to cancer, developmental, and reproductive disorders. The second one, toluene. Long-term exposure to toluene can cause skin and respiratory irritation, headaches, dizziness, burst effects, and damage the nervous system. These are the things that I don't want my children to breathe. In addition to these health impacts from the pollutants that arise from the natural gas industry, is also the issue of climate change, which impacts the health of my children. I want to touch a little now on how climate change affects children's health. They develop allergies. In addition to increasing smog pollution, climate change has increased the length and severity of pollen seasons. Pollen season has already lengthened 2 weeks since 1995, and the total pollen count is still on the rise. Ragweed pollen production increases with heat and carbon dioxide. This allergen can trigger asthma attacks and cause severe discomfort among children with allergies. What about asthma? Smog or ground level ozone is a powerful lung irritant that can trigger asthma attacks and interfere with lung development. Children suffer the most from the health impacts of smog and increased sensitivity to irritants and allergens, as well as chest pain, coughing, and nausea, even in healthy children. What about mental health impacts? Extreme weather events cause physical harm and can also have intense psychological effects on survivors. Children and families experience anxiety and stress around severe weather events, which include long-range mental health effects. There are lots of other health impacts that health experts are linking to climate change, but these are just a few. I want to focus on one of the many factors that contribute to asthma, and that's air pollution. What about asthma and outdoor air pollution? Asthma, the disease, is generally understood to be an inflammatory disease caused by a combination of genetics and environmental factors. People with asthma are especially sensitive to pollutants released from cars, buses, heavy machinery, factories, and power plants, including soot, smog, carbon monoxide, sulfur oxides, nitrogen oxides, and lead. Contacts with an asthma trigger, like air pollution, can cause the muscles around the airways to tighten, and an asthmatic attack can occur. Without proper treatment, asthma can be life-threatening. Asthma and indoor air pollution. Numerous chemicals found in indoor environments have been classified as asthmagens, environmental agents that cause or exacerbate asthma. These chemicals can be found in building materials and commonly used household and personal care products. Exposure can occur during product manufacture, installation, and everyday use. Many of these chemicals are found at home and in the workplace, where we spend 80% of our time. This has been one of many links to the development of asthma and other severe symptoms and attacks. Some asthma-linked toxic chemicals are even found in personal creams and lotions, according to the EPA. Latinos are disproportionately vulnerable to air pollution. Latinos are 165% more likely to live in counties with unhealthy levels of particulate matter pollution. Nearly 2 in 5 Latinos live within a 30-mile radius of a power plant. 1 in 2 Latinos live in counties that violate ground level smog standards. Today in the United States, Latino children are 40% more likely to die from asthma than non-Latino whites, and nearly 10% of Latino children under the age of 18 suffer from the chronic respiratory illness. Among all ethnic and racial groups in the U.S., Puerto Ricans suffer the highest incidence of asthma, more than double the rate of non-Hispanic whites. Studies show that childhood asthma is more common amongst Puerto Ricans than any other Hispanic group, according to EDF and the EPA. I would like to share with you some health figures on how asthma has currently affected nuestro Latino community. In 2014, 2.1 million Hispanics reported they currently have asthma, according to the U.S. Department of Health and Human Services Office of Minority Health. Right now, 16.5% of Puerto Rican children under 18 have asthma, and that's compared to 8.5% of Hispanic children and 7.1% of Mexican American children, according to the CDC. What you'll notice is that Latino children with asthma have worse health outcomes than other children with asthma. This may be a result of healthcare issues or simply overexposure to environmental pollutants that are asthma triggers. Okay, bringing it home here. What can you do? The California Public Utilities Commission has proposed a set of mandatory best practices to ensure the gas stays in our pipelines and storage facilities. We at Moms Clean Air Force have launched a campaign asking the CPUC to implement these 7 best practices. Please join me now by telling the CPUC that you are relying on their leadership and their authority to instate strong rules to address leaks by signing the action letters found in your chairs. Si se puede, yes we can, for the health of our children and their future. Thank you very much for your time. It was a pleasure to be here with you tonight. Buenas noches.